Evoclin Foam is a medication used to treat acne by decreasing the number of acne lesions. It contains clindamycin, an antibiotic that works by stopping the growth of bacteria. It is usually applied to the affected area once a day, preferably in the evening. When using Evoclin Foam, it is important to only apply it to the affected skin. Make sure the area is clean and dry before applying the foam. Follow the directions on the product package or as directed by your doctor. If you are using the foam, apply it to the affected areas as directed by your doctor, usually once daily. Use enough to cover the entire affected area. Do not spray the foam directly onto your hands or face, because the foam will begin to melt on contact with warm skin. Instead, spray the amount needed directly into the cap or onto a cool surface such as a countertop. If the can seems warm or the foam seems runny, run the can under cold water. It may take between 2 to 6 weeks to notice an improvement in your condition, and up to 12 weeks to see the full benefit. Wash your hands after use and avoid contact with your eyes, nose, mouth, or any areas of broken skin. If you accidentally get medication in these areas, rinse well with plenty of cool water. Remember to tell your doctor if your condition does not improve or worsens. If you experience burning, itching, dryness, redness, oily skin, or skin peeling, make sure to tell your doctor or pharmacist. This medication may be absorbed into your bloodstream and very rarely cause a severe intestinal condition due to a bacteria called C. difficile. If you develop diarrhea that doesn't stop, abdominal or stomach pain/cramping, or blood/mucus in your stool, tell your doctor right away. Do not use anti-diarrhea or opioid products if you have these symptoms. A very serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before using Evoclin Foam, it's important to talk to your doctor or pharmacist if you have any allergies to clindamycin, lincomycin, or any other allergies. This product may contain ingredients that can cause allergic reactions or other issues, so make sure to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have chronic asthma or hay fever, intestinal diseases such as ulcerative colitis or enteritis, or C. difficile-associated diarrhea. If you are planning to have surgery, it's important to let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, it's important to inform your doctor before using this medication, as the effects on pregnancy are still unknown. It's also unknown if the medication in Evoclin Foam passes into breast milk, so consult your doctor before using this product if you are breastfeeding. When using Evoclin Foam, it is important to be aware of potential drug interactions that may affect how the medication works or increase the risk of serious side effects. It is important to keep a list of all the products you are using, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is crucial to follow your doctor's guidance and not make any changes to your medication dosage without their approval. If you or someone has taken too much Evoclin Foam and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, reach out to a provincial poison control center. Evoclin Foam can be harmful if ingested, so it's crucial to act quickly in the event of an overdose. This medication is for use on the skin only. Do not use it on the groin or underarms unless directed to do so by your doctor. Avoid contact with the eyes, mouth, and mucous membranes. If contact occurs, rinse thoroughly with water. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same time each day. Do not use large amounts or apply this more often or for a longer period than directed. Your condition will not improve any faster, and your risk of side effects may increase. If you forget to use Evoclin Foam, apply it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and continue with your regular schedule. Do not use a double dose to make up for the missed one. When it comes to storing Evoclin foam, it's important to follow the specific instructions on the product package or ask your pharmacist for guidance. Make sure to keep it out of reach of children and pets. When it comes to disposing of Evoclin foam, it's important not to flush it down the toilet or pour it down the drain unless instructed to do so. Instead, properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.